Hi there, Eric Backer. Thanks for tuning in. I get many questions, from my subscribers, as you can well imagine. And some questions I can respond to, some I can't. Some questions I get all the time, and some I get, every now and then. Here's a question I do receive regularly from people, and this is a question from a lady over in Spain, which is an interesting one. Eric, I have blood in the stool, occult blood. What does it mean? What are the causes? What do I do? She's really stuck here with this problem. So, and she also mentioned in a comment to me that her mother had bowel cancer, and she's quite worried about that. She's wondering if she could have bowel cancer. So, let's talk about occult blood and really what that means, and whether you should be freaking out or not. So, many people at some stage in their life will pass, some blood through the stool. Now, for most people, this will be quite. It won't really mean much. It'll only be a small amount. It can be the result of a hemorrhoid. It can be the result of some type of intestinal parasite or infection. It can happen from time to time. These can be anomalies that can occur with people. However, if you're passing out blood regularly, if you notice it when going to the bathroom that it's regularly coming out on the stool, it definitely warrants investigation, further by the doctor, particularly blood tests. And especially if you've got fatigue, you're tired, you've got poor immune function, you've got any rectal itching, you've got really, really fatigued, you've got brain fog, stuff like that, it will require definitely some more in-depth investigations to determine what is going on. It could be one of 100 different things going on. It could be something as simple like a hemorrhoid, which is very, very common with so many people. But it could also be something more sinister, like a stricture or a problem with the colon. Okay, there could be, polyps inside there. There could even be bowel cancer for all you know. So these things are well worth checking out. Bowel cancer is much more common than you think. Many people have bowel cancer, in fact, where it's never diagnosed. So I highly recommend, for this reason, that you stay on a very, very good diet and always strive to eat very good, healthy foods to help prevent conditions like bowel cancer. Which is linked with things like heavy alcohol use, eating too much red meat, obesity, high stress, things like that, can contribute to this terrible disease. So, the blood in the stool question is an interesting one, and you can go to your doctor and often get a stool test done for what we call occult blood. So, occult, no, we're not talking about devil worshipping and stuff like this. We're talking about occult blood. So blood that is found in a place where it shouldn't really be found. Blood should not be found, in the toilet bowl, shouldn't be there. So a fecal test, there are various tests that they can do. They can also do this particular marker, for example, to determine whether you've got bowel cancer or not. It's a particular type of stool test that can be done as well through a lab. So if you're concerned, you can actually ask for the stool test to determine whether you've got a bowel cancer risk or not. It's a particular enzyme called MPK2 kinase or something. I can't remember exactly what it is, but it's a particular marker to determine, whether you've got colon cancer or not. So that could also be done if you wanted to at the same time or at a later date to determine that. But often if you get repeated occult bloods coming back, further investigation, you may need to go to the gastrointestinal doctor for a proper examination, and a checkout there to make sure. So yeah, and the other thing I recommend if you've got a fecal occult that's positive is to get a complete blood count done, and particularly ask for iron studies to determine what's happening with your red blood cells. You could have a low ferritin count, for example, Ferritin, ferritin, which is an iron storage protein. So if you've got low ferritin, you could have been bleeding, losing blood for a long period of time, particularly if you're weak and tired. Get B12 and folate also checked. Very important elements, that go along with the red blood cell cascade there. So get RBCs and red blood cell screen done, and maybe B12 and folate, and then find out what's going on. So I hope that gives you a bit of useful information there on occult blood. If you're in doubt, go to the doctor, get blood tests done, and take it from there to see what happens. So I hope that gives you good information. Thanks for the question. Thank you.